And welcome back to Sunday House Call. Now for our segment, Should I Worry?, which every week we talk about everything that worries us. One viewer writes, my husband is 72 and a smoker for 50 years. He's having a burning sensation in his esophagus, and he's very worried it may be cancer. So, Dr. Siegel, how do you know if you potentially have esophageal cancer?
Well, you don't know, but I'll tell you something, Eric. Somebody over 50 years of age, that's the magic number. If a person's younger, I might try to treat it. But someone over 50 that has a burning in their esophagus, that smokes, I think that patient, and again, I don't know this patient, but that patient I would send to a gastroenterologist and have an upper endoscopy done to make sure that their esophagus is okay. There's something called Barrett's esophagus, where the lining of the esophagus changes, and then we follow it over time, and we treat. And we've already talked about on what you got to do on the show. You got to lose weight. You got to stop smoking. You got to exercise. You got to change your diet and stop eating the kind of foods that are bad for you. Alcohol is terrible for your esophagus. Coffee, which we love on the show, is bad for your esophagus. So you have to modify your diet. More cooked vegetables is good.
But what are the symptoms besides, let's say, burning? How do you know if you have esophageal cancer, and is that just burning?
Well, you know, a lot of times you don't know. We talked about pancreas last week. Sometimes you don't know, but burning is one, weight loss would be another, swallowing difficulties is another, fatigue is always a worrisome sign, and if I find anemia when I'm looking at you, I worry about that.
You know, in a case like this, esophageal cancer is not on top of the differential diagnosis. Somebody who's been smoking
for... what does that mean, differential
meaning
diagnosis?
That if you, as a doctor, if you analyze, if this patient comes to the office, you're not going to be thinking about esophageal cancer first. 50-year smoker is lung cancer until proven otherwise, and you may have mass in your chest that could be causing the similar symptoms. So you want to make sure you get a chest x-ray, listen to the patient, find out what his lung capacity is he having any sort of asthmatic signs or not. That's the first thing. The second thing is, if you've been smoking for 50 years, I would be very worried about oral cancer and in the mouth, and then I would start coming down to the esophageal cancer. It's not common. We see about 16,000 of these patients. Unfortunately, 14,000 die from esophageal cancer. And difficulty swallowing, chronic cough of over 6 weeks, hoarseness, these are some of the symptoms of esophageal cancer. And the sooner we get them, the better outcome. The reason why people get this is because the reflux, the gastric reflux, if you're obese or if you have, for some reason, loose sphincter, acid can go up and cause this Barrett's esophagus. The other thing that can do this also is smoking and alcohol. And again, one of the major problems that we have is from anesthesia and endoscopy, people can have sometimes complications. You can go through the transnasal, do the scope, and go down without any anesthesia and find out what's going on. And
you just mentioned acid reflux. Is that connected at all?
Completely. And acid reflux, by the way, increases your risk of esophageal cancer. Now, I want to emphasize a point David made, which I agree with. The numbers are much greater for lung cancer. This patient, I'm more worried about his esophagus with that burning. But I screen all of my smokers because there's 180,000 cases of lung cancer a year. If you're a 50-year smoker, I would do a CT of the chest. Not everyone agrees with me on that, but I think you have to screen heavily for lung cancer as well. The patient sounds like esophageal or reflux.
What's interesting is that in this particular case, when you put them on anti-reflux medications, it works well because this particular case, reducing any kind of future Barrett's. And we see about 2% of Barrett's patients that can convert to cancer. And there are some surgeries, there's also some laser treatments for Barrett's esophagus. So you should be talking to your doctor about this.
But you don't just use medication. You have to get this patient evaluated by a gastroenterologist, not just the reflux medication.
But can acid reflux cause cancer?
Absolutely. Well, absolutely. If you have untreated reflux disease of the esophagus, you can get esophageal cancer.
I'm so glad we did this segment because it's such a quiet, secret, unknown thing. Please, especially if you have acid reflux, and a lot of us.
But going to over-the-counter and taking a pill from just over-the-counter is not the right answer. I want people to know this. See the specialist. That's the key.
Very good.